Hello everyone and welcome to ADO's September webinar. September is Leukemia Awareness Month, and you may have seen people wearing the orange wristbands and ribbons to show their support. To show our support and to raise awareness, this month's webinar will be all about the symptoms, causes and treatments for leukemia. Today's speaker is Clinical Assistant Professor from Georgetown University and ADO's Medical Director, Dr. Howard Zahalsky. Welcome, Dr. Zahalsky, and thank you for joining us today.
Thank you, Tom. I'm excited to be here. So today we're going to talk about leukemia. Before we talk about leukemia, we have to understand the morphology and how your blood is made up. So this is a picture of what we call a smear of your blood, or what a pathologist, a doctor who looks at things under the microscope, would find if they looked at a typical person's blood under the microscope. I'm going to go through a few minutes to give you a basic education on what blood looks like. So here you have several different types of cells that you are looking at. The first thing I want to draw your attention to is the little pinkish, roundish things that make up most of the things that you see. Those are red blood cells. And as you can see, they're mostly circular. Some of them have a slightly cleared center. That's just because they were caught directly from the front. The other ones all have a cleared center, but you can't necessarily see them because they're slightly angled. The second thing that you'll notice, and I am intentionally avoiding the big things in the center of the slide, are these little bluish purplish things that look like drops of ink that are much smaller than the red blood cells that are kind of dotted around the screen. Those are what's called platelets. Platelets are little fragments of cells that are responsible for clotting when you cut yourself. So if there's any damage to a blood vessel, if you prick your finger, they're what stop the bleeding. They glob together and make a scab. And finally, there are the big, ugly-looking things, which are actually very important, which are the white blood cells. The white blood cells here have kind of a gray look to them with a bright blue globular areas in the middle of them. Those really dark blue areas that look like unorganized globs are what we call the nucleus. In this case, what we're looking at is myeloid white blood cells. There's two different types of white blood cells. There are myeloid ones and there are lymphoid ones. Myeloid white blood cells, which include neutrophils, and these are actually neutrophils, have these disorganized sectional nuclei. They're certainly bigger than red blood cells, and they're responsible for fighting bacteria in your body. Here you have another normal slide. It's stained slightly differently, so the cells are slightly different color. Again, you see quite a number of those red blood cells. You kind of see the clear areas in the center a little better on this slide. You still see some of the platelets. You still see some myeloid cells, cells that are much larger than red blood cells and have these sectional nuclei. But in this case, the background of the cell is exactly the same color as the red blood cells, kind of a pinkish look. These myeloid cells are called eosinophils. They're the cells that are responsible, every time you get a runny nose when you smell pollen, they're responsible for fighting allergens. But there is one different cell in this slide that I want to draw your attention to, which is towards the bottom right. It looks, I would say, kind of like a giant platelet. It looks all evenly blue, and that's actually a lymphoid cell or a lymphocyte. Those are the white blood cells. They're usually slightly bigger than red blood cells, but not as big as the myeloid cells that are responsible for fighting, in particular, viruses, but sometimes parasites as well. This is, again, a fairly normal smear with a few white blood cells, but mostly red blood cells throughout it. All right, now that we have a good idea of what white blood cells of the two different types and the red blood cells and the platelets look like, we can go on and see what an abnormal slide looks like, and we'll see that on the next slide. So this is a case of CML, or chronic myelogenous leukemia. We're going to walk through this slide a little bit so that we can understand what is making it look so different. You certainly still see some of those red blood cells floating around, but there is certainly many, many more white blood cells compared to how many there were on the other slides, where there were 3, 4, 5 on the whole slide. There seem to be almost as many white blood cells as red blood cells. Now, let's talk about the symptoms for a minute. What would make you think that this person symptomatically might have a problem that you would do a smear for and find this? So again, this is a case of chronic myelogenous leukemia, but most leukemia has very similar symptoms. Because you have extra infection-fighting cells, white blood cells, whether they be the lymphocytes or the myelocytes, you're going to get low-grade fevers, chills. You're going to feel like you're fighting off an infection for some reason. You might get the sweats. You're going to be achy all over. You're going to be weak. You're going to be tired. You're just going to feel that something is not right. You're going to go to the doctor, and the doctor's going to look at you and say, your lungs sound clear, your heart's beating okay, let's do some blood work. And they would find that you have way too many white blood cells, and when they looked at the smear, this is what they would find. So here you know that it is myelogenous leukemia, and in fact chronic myelogenous leukemia, and that will become important later, in that you can see many, many of the cells have those lobulated nuclei. And you can see several of those, many of those throughout the slide. But then there are some unusual cells. There are white blood cells. Already we're supposed to know that the myeloid cells are bigger than the red blood cells. And in fact, the myeloid cells are generally bigger than the lymphocytes. But there are some much, much bigger cells that have big round nuclei and look to be 2, 3, 4 times the size as the regular myeloid cells. Those cells are what's called blasts. They are immature cells that have escaped from the bone marrow where blood cells, including white blood cells, are made, and they escaped before they had time to ripen. Because of that, they're floating around and they don't know what to do and they don't know how to behave, and they're releasing their chemicals that are usually reserved to destroy bacteria into the bloodstream and making you feel ill even when there might be no bacterial infection. There's clearly too many of even the mature, normal-looking myeloid cells, but there's definitely too many of these blasts as well. Because there are a lot of the mature version, this is, again, what we call a chronic myelogenous leukemia, and we'll get to what more acute or quick onset leukemia looks like later. This is also chronic leukemia. This leukemia is chronic lymphocytic leukemia. Again, you can see what look to be normal lymphocytes in this picture. You see cells that are slightly bigger than the red blood cells that are round, that are mostly made up of that dark bluish, purplish nucleus. But there are a few of them, the ones more towards the left, the one over on the right, that look a little bit bigger than they should be, have a little bit more area of grayish, bluish around the nucleus than they should be. And those are slightly immature lymphocytes. There's also too many of them. On the normal slide for lymphocytes that I showed you, there was 1 on the whole screen. Here you've managed to capture 5 in a very focused portion. There's too many lymphocytes, but many of them look fully mature, particularly the one towards the bottom and in the cluster of 3 over to the left, the one on the most right of those. Those look normal and mature, so this would be chronic lymphocytic leukemia. So those both represented chronic leukemia, where some of the cells were able to fully develop, whether they be myeloid or lymphocytes. Here you have an acute leukemia. This just looks like a mess. You can't tell if this is myelogenous or lymphocytic without the use of some special tests. All of the cells that you see are blasts. The red blood cells in between the white blood cells even are looking abnormal. Many of them are misshapen, and that's because the leukemia, the cancerous blastic blood cells are taking over the bone marrow and pushing everything else out. Not only are the white blood cells coming out immature, but even the red blood cells are coming out immature because they don't have a chance to ripen before they're getting pushed out of the marrow, because the marrow has become so crowded with these immature large blood cells. Here is one type of unique leukemia. Look right in the center of the screen. Most of what you see are, we call this, sheets of lymphocytes. Most of these cells that you're looking at on the screen are lymphocytes. They are those small round cells. You don't see much in the way of red blood cells in this, and that's because although this is a leukemia, this is actually a biopsy of a lymph node. And what you're seeing is areas where you have groups of lymphocytes, but you see this really unusual thing right in the center. It looks like a giant pink cell with, we like to say, owl eyes. That is what's called a Reed-Sternberg cell, and is classic for a condition called Hodgkin's disease. Hodgkin's disease is a leukemia that also affects the lymph nodes and tends to have a better prognosis than many other types of leukemia. So this doesn't really show leukemia, but I'm going to use it to explain how we get to the treatment of leukemia. Leukemia is a cancer of white blood cells, either the cancer of the myeloid white blood cells or the lymphocytic white blood cells. And for most types of cancer, there's a general rule: you cut them out. If you have breast cancer, you cut out the breast tumor. If you have liver cancer, you might cut out the liver tumor. If you have lung cancer, hopefully you're able to cut out the liver tumor. However, you cannot cut out your bone marrow. The leukemia is based on cancer of white blood cells, which are formed in the bone marrow. And this slide is intended to show that the bone marrow is trapped deep inside your bones. And so short of cutting out all of the bones in your body, because it's hard to tell exactly where the cancer is coming from, since it's just kind of floating around in the blood, you are trapped and you can't possibly cut it out. So how do you treat it? Well, you have to treat the different cancers differently. The reason I showed you the chronic leukemias first is because those have to be treated in a completely different way than the acute leukemias. I'm actually going to start with the treatment of acute leukemia. Acute leukemia is usually treated by chemotherapy. Acute leukemia cells grow very fast and reproduce and eat food at an alarming rate. Now, what's food for white blood cells? It's all sorts of chemicals that are naturally found in your body, glucose that's found in your body. But because they are making so many immature cells, the bone marrow, the stem cells which are in your bone marrow, which are responsible for making these white blood cells, are growing and eating very, very, very quickly. Think of it like a ravenous puppy as opposed to an old, tired dog that just sits there. So if you're going to give a poison that kills cells, or in this case, unfortunately for my analogy, puppies, the dogs that eat more, the ravenous puppy is going to scarf down that poison much more quickly than the old dog, and as a result, they're going to die quicker. Now, I don't want to encourage anyone to poison dogs or puppies, but when you have cancer, the faster growing, more ravenous cancer cells eat chemotherapy a lot quicker, which is basically poison, and they die quicker. So acute leukemias, which are much more common in young people, in late childhood to early adolescence, people with kids with leukemia respond fairly well to chemotherapy, and in fact, we're able to cure upwards of 80–90% of children with childhood leukemia, which is usually acute myelogenous leukemia or acute lymphocytic leukemia. Older people in their 60s and 70s are much more likely to get chronic leukemia. Now, chronic leukemia doesn't respond nearly as well to chemotherapy. The cells are growing much slower, and as a result, they're not eating the chemotherapy, the poison, fast enough to die before making more leukemic cancerous cells. So what do you do for chronic leukemia to treat it, since it's not going to eat the poison fast enough to kill itself? Bone marrow transplants. Generally speaking, the only way to cure chronic leukemia is with a bone marrow transplant. What is a bone marrow transplant? I assume most people have probably heard the term bone marrow transplant. And a bone marrow transplant uses stem cells and gives a person new stem cells. The stem cells, as you heard me say, are the cells that make all of your white blood cells. They actually make all of your blood. They make the red blood cells, they make the myeloid cells, they make the lymphocytic cells, they even make the platelets. So you need these stem cells to make everything in your blood. And it's one or two of those stem cells becoming cancerous and starting to make cancerous leukemia cells instead of the normal healthy cells that become the problem. In order to give someone a stem cell transplant, two things are necessary. Number one, you have to find a donor. You have to find a donor that is very closely matched in terms of many DNA characteristics, or else the donor's white blood cells will see the rest of the person's body as bacteria and viruses and unfamiliar, and will attack the person who is receiving the transplant. We call that graft versus host disease. So you have to be very careful to very carefully match the stem cells from the donor with the DNA makeup of the recipient. The second thing you need is you need to kill all of the recipient's, the sick person's, stem cells, every single one. Now you could say, wait, if you kill all of someone's stem cells, you're getting rid of all of their blood, you're getting rid of all of their ability to clot, and you're getting rid of all of their ability to fight any infection, bacterial or viral. And yes, that is in fact the case. While you are getting a bone marrow transplant, there is a period where you are given strong chemotherapy to wipe out every last stem cell in your body, where you are in grave danger. You get very low blood counts. We need to give you transfusions to keep your red blood cells up. We need to give you antibiotics to make sure you don't get any bacterial infection. We need to keep you in isolation to make sure that no viral infections get in, because even the slightest little infection can kill you when you have no ability to fight off infections, while we subsequently give you the stem cells from somebody else and wait for them to grow enough blood and enough white blood cells to fight infections and enough platelets to stop clotting for you to survive. But bone marrow transplants can be very, very dangerous. But again, they are the only foolproof way to kill chronic leukemia. And even then, they don't work 100% of the time, because sometimes one or two of your own stem cells survive and the leukemia can come back. So here I have a little newborn baby, and the point I want to make here is that umbilical cord that you see tied off coming out of the baby. More and more people are opting to save the stem cells from their babies when they are born. Those stem cells are some of the best, most pure stem cells in the human body. When you donate stem cells, when someone who is a biologic match to you, you're able to draw off their stem cells out of their bone marrow. Those stem cells are less perfect because they're stem cells that have been around for quite a while by the time they've been donated. These are the most pure, best to use stem cells are the stem cells from a newborn baby found in their umbilical cord. So now there are many companies out there that when your baby is born, you can ask your obstetrician to draw off some of the blood from those umbilical cords, and these companies will store it for you. So if that child or even a close relative needs a stem cell transplant at some point, it's almost as if you have leukemia insurance, so that if you need stem cells, you have some perfect stem cells on ice waiting to use. You will hear differing things from from medical organizations and from the stem cell companies on how effective this has been, whether spending what can be thousands of dollars for this leukemia insurance has ever been useful. The stem cell companies will say that their stem cells have been used many, many times, and the medical organizations will say that there's little proof that any stem cells from what we call cord blood banking have been used to save anybody's life. The jury is still out on how useful, but when it comes to insurance, many people feel that you can't have too much insurance. So, in summary, if you start to get weird symptoms that you feel you're fighting an infection that seems to be going on too long, make sure you get to your doctor. Whether you're young or old, they can check your blood to see if maybe you are suffering from leukemia. Acute leukemia, often treated with chemotherapy. Chronic leukemia, which is much slower and kills much fewer people because it actually is a disease that takes 10 years or more to actually kill somebody, is, if you need treatment, best treated with bone marrow transplants. And keep in mind, if you're having a new baby, you may want to consider saving some stem cells, because those are some of the best stem cells that you can use ultimately for if that child ever gets leukemia or a family member gets leukemia. So how can Activ Doctors Online help you with leukemia, prevention of leukemia, or curing leukemia? First of all, we have our personal health records. Our innovative online personal health record platform will allow you to keep track of all of your medicine, all of your family history. There are certain types of leukemia that are very genetic, and if one of your family members, it turns out, has one of the genetic types of leukemia, by keeping track of all of that information online as you maybe change doctors because you move or you get older and you switch from a pediatrician, having all of that information available and to you for your entire life, not just limited to one doctor's records, can be very helpful. With our e-consultation feature, we can put you, if your doctor is a member of Activ Doctors Online, in touch with your doctor online. So if you have any questions but aren't able to get in for a doctor's visit, we can make things more convenient for you and your doctor to have a conversation about leukemia or any other condition. Finally, with our second medical opinions, we can put you in touch virtually with some of our top specialists from around the country and around the world. Leukemia can be very serious, and there are only certain centers, usually in major cities, that do things like bone marrow transplants, especially in some of the new ways that bone marrow transplants are being done. If you live especially in a rural area, you may not want to trust the local oncologist to be up to date on all of the latest advances. And with our second medical opinions, we can put you in touch with some of the top experts from some of the top hospitals around the country so that you can make sure that the treatment regimen recommended for you, if you or a family member has leukemia, that you're getting the best advice. All right, with that, I'm going to turn it back over to Tom, who could tell you some more about getting started with Activ Doctors Online.
Well, thank you, Dr. Zahalsky, for another great presentation. Here at Activ Doctors Online, our vision is to reinvent healthcare by providing user-friendly mobile health solutions that allow people all over the world to live safer, healthier, and more productive lives. We strive to educate, engage, and empower our members to take control of their health destiny to save time, money, and even lives. We hope you've enjoyed today's presentation, and we invite you to get started with a free 30-day trial over at activdoctorsonline.com and by clicking Get Started. For more information, to schedule a demo, or if you have any questions about our service, please feel free to contact Activ Doctors Online using the information on screen, and we're also available on all the social media networks. Thank you for watching, and we look forward to seeing you next month for another informative health webinar.